Good morning and thank you for joining us. We will begin today with a brief update from our Chief Health Officer, Dr. Patrick Ludke, followed by a case update and some other notifications for you.
Good morning. Thank you, Jason. Thank you for joining us today. So I wanted to speak briefly with an update on the 7 criteria we feel that are important to opening up our communities to return a bit to where we were in pre-COVID time. And you've heard these before, and this is an update on where we feel we are with regards to each one of them. So the first one, as you know, is falling cases of this particular infection in the human population over the course of an incubation period or 2 incubation periods. It gets a little harder to determine what that means when you've prevented the peak. We feel that the strong work we've done so far and that the community has helped us with has prevented a peak, and instead we've had a plateau where we get 0, 1, or 2 cases a day. And we're very happy with that, but we still are getting a case or 2 per day. But we're on track in the next week or 2 perhaps to be able to say that we've met that first criteria. The second criteria is looking at the issues around availability of laboratory testing. We're very fortunate now. About 2 weeks ago, we had our first ever laboratory doing COVID testing within Lane County. As many of you know, prior to that time, all of the samples that were collected were sent out of state for testing or to the state lab up in the Portland area. Now we have 2 different laboratories locally doing that work, working up to about 500 tests a day, which is pretty good. We feel that that's a good set of progress for us to move forward on. We're hoping to get perhaps to 1,000 a day sometime in the next few weeks, and that would be placing us in a place of success, I think, in the testing area. Number 3 is sufficient contact tracing resources. We're very fortunate to be in a fairly large county and with a large Department of Health and Human Services where we've been able to really borrow a fair number of staff from other divisions within our Department of Health and Human Services. Unfortunately, it's not that way with all of our neighbors. Some of our neighbors experiencing a higher level of cases per population don't have as deep a bench as we have. So we're all in this together. But in terms of contact tracing locally, we've been doing well. I think some of you may ask, well, okay, we're doing okay, but we haven't been overwhelmed with a large number of cases, and that's true. If we were to have a massive peak, we would probably need to borrow resources from other sites. That would include interacting with the plan that the state has in place to provide contact tracing resources. So we are looking at that as well. Item number 4 on our list is working with our clinical agencies to scale up rapidly. So we're on a plateau right now. We're looking for clear signs that the plateau is decreasing. We have a bit of a signal today. We have no patients in the hospital, which is a wonderful thing. That's the first time in quite some time we've had no acute cases in the hospital. But until we get to a point where it's definitively clear that we are decreasing, we really have to look at a horizon where we could be overwhelmed with many, many cases and a large peak like we've seen in other jurisdictions. So we are meeting regularly with our hospitals. We have another meeting this week to look at specific ways of how we can best open up and then prepare if we get a big wave to close, so to speak, and make sure that the hospitals are ready for a big bulk or bolus of new patients. Item number 5 is sufficient PPE. Locally here at the health department, we've been for, more than a month now, stockpiling and giving out PPE to those clinical entities who are experiencing critical shortages. We now have a pretty deep bench of those items, gowns and gloves and masks and face shields and even hand sanitizer. And we're at a point now where we're feeling much better than we felt several weeks ago. So again, item number 5, in a better place. Item number 6 is a blueprint for the community to understand what it looks like when we move to restriction relaxation. And that blueprint is coming, and of course we're working very closely with the state on it as well. I think it really has 2 main pieces. It has the broader public piece, so everybody can understand what it is that it looks like to relax restrictions, and then the business community. And that includes my definition of business in the broadest sense. That includes nonprofits and schools, et cetera, that keep our society going, and how we can make sure that they as well are prepared for this restriction relaxation. And then finally is, again, I think talking about how it is we're not in this alone. We need to make sure that we align with the state and the other 35 counties in the state of Oregon. It would be one thing, again, for us to be lucky and have a massive decrease in cases or perhaps no new cases, but be surrounded by other counties that are having significant outbreaks. And eventually, those cases would come to us, given the amount of commerce that we have and given the way this virus can travel. So we need a real strong liaison with the state and the other 35 counties to make sure we do this together. So that's a brief update on where we are, perhaps not as much detail as some of you would like, and perhaps more detail than some of you would have liked, but I'm going to stop there and turn it back over to Jason.
Thank you, Dr. Ludke. And before I get started, I would just like to really take a moment and have a genuine thank you to Dr. Ludke. This is a man who has served in the infectious disease world for decades, both for our U.S. military and the Navy, as a lab director for the state of Utah, and we are very fortunate to have him here. And probably the one trait that I think sort of defines him is, with all that experience, with all that knowledge, and really being a thought leader in the realm of public health, he still has time to take individual community concerns and talk through people's suggestions and with a degree of patience that is really impressive. He really has a heart for our community here, and we are fortunate to have him at the lead of our clinical recovery piece. So we are still holding at 50 cases, which is fantastic. I know we've been at this number for a few days now, and that is really indicative of the plateau that we've been talking about. We have around 3,082 tests coming from Lane County to our labs, and I'm happy to report that quite a few of those tests that are coming from Lane County are being processed right here in Lane County at McKenzie-Willamette Hospital and Peace Health Hospital. So good news there. We have 0 people hospitalized, which Dr. Ludke alluded to. We have 23 individuals still sick at home, still holding at 2 deaths. And a really significant piece of information here, one that I think deserves a little bit of celebration. We have 25 individuals in recovery. And why that is important is that we only have 23 individuals sick at home. So we have more individuals who have recovered than we do currently have active cases. And I think that that is something to celebrate. And while it's very true that we don't have a complete picture of the case situation out in the community, we do have some indicators, and this is a fantastic indicator. Some other news that before we close here and take some questions from members of the media. Folks will remember the Ordinance 20-03, which was going to require hotels and motels to honor government vouchers during an emergency situation for hotel rooms. We were looking to use those vouchers specifically for individuals who are unhoused, who need a place to recover from COVID-19 and also remain isolated during that time. And if you remember, this ordinance was first read by the county commissioners and then was going to be voted on in coming weeks. We now have negated the need for this ordinance thanks to our partner in the community, Sponsors Incorporated. Sponsors stepped forward and said, hey, we have these tiny homes that we have built and recently constructed, and they're completed now. We would be willing to let the county use those free of charge if the county agrees to take the lining up the individuals who would be there and the services that they will need while they're staying there, and then the cleanup afterwards. If the county's willing to do that, we will provide these units free of charge. And so that has really been a tremendous piece for us in terms of making sure that our unhoused community has the resources to follow the governor's stay-at-home orders and just a place to recover, as a human being who needs a roof over their head and a warm place to sleep while they are likely feeling very miserable from a very severe illness. So thank you to Sponsors Incorporated. Their executive director, Paul Solomon, has been a true leader during this whole process. So Really great news there. Dr. Ludke mentioned our blueprint for reopening, and I just would like to, while it doesn't mean much from a distance, this document right here, several different pages, is the working document for that blueprint. And as he mentioned, there's still a lot to be done on that document, that we're going to have that in place before any recommendations are made. But we would just like to let you know that that work is in progress, and we are working on it every day. It is one of our top priorities right now, coming from the Emergency Operations Center, and you should expect to see more news on that shortly. We're also working on that dashboard where we're going to be able to share with you in real time the progress that we're making on Dr. Ludke's 7 recommendations and how we're doing in terms of that work with the state and the recovery phase. So be looking for that as well. Finally, I would just like to announce the fact that we are going to be this week starting testing at some of our congregate settings. We're going to begin with the congregate settings that we have set up for unhoused community at the Wheeler Pavilion and the Memorial Building in Springfield. We will be utilizing some of the testing that is available through Mackenzie-Willamette Hospital to do what we call Sentinel Surveillance. And so that includes testing asymptomatic people in the hopes that we can get a better idea of where the virus is currently happening in our community. Some of those cases that would have otherwise gone undetected with the past testing situation, we will now be able to have a window in and start gaining some understanding. So we're going to begin with those facilities and then look at expanding that very shortly. Our emphasis and priority really is in the situations where the disease could wreak havoc very quickly, and so that's going to start with those congregate settings, both at the fairgrounds and Memorial Building, but then also looking at some other areas like long-term care facilities. At this time, I will go ahead and take any questions from members of the media.
Our first question is about the state of our PPE and ventilators.
Yes.
How much do we have and how quickly are we using it?
So we have 122 ventilators in our hospital settings here in Lane County, which we're very fortunate to have that high of a number. Currently, none are being used for COVID-19 patients because we don't have any COVID-19 patients in the hospital. So that is one thing that we're monitoring very closely, and thanks to some systems already in place, we can sort of have a real-time look at how those ventilators are being used and making sure that we're planning accordingly, and also looking forward to the second wave and what that would mean for that second wave.
Rachel from KLCC, has Lane County had any local reports of people drinking Lysol or bleach?
So Rachel from KLCC, has Lane County received any reports of people drinking bleach or Lysol? And fortunately, Rachel, we have not heard of any instances of this. I think that local health departments really stepped up their game in that messaging. Early on, at the very onset of this outbreak, we actually saw a similar message out there. The Poison Control of Oregon reached out to us and said, can you please get the message out that individuals should not drink bleach or ingest bleach? It's not an effective treatment. And so obviously that has remained part of our messaging and something that we're trying to get out there. And then you saw the emphasis on that in this last week, where there was Lysol themselves as a company came out and talked about that. So I think people heard the message loud and clear that that is not an effective treatment for COVID or virtually anything else, that ingesting bleach is very dangerous and should never be done.
Also from Rachel, can you clarify whether the sponsors' tiny houses will be for folks who are ill or only if they're confirmed to have the virus?
So another question from Rachel at KLCC, will the sponsors' tiny homes only be for the ill, or will they also be extended to individuals who are suspected of having COVID? So Rachel, fortunately with the testing circumstances as they are, if someone is suspected, we can now move to testing that individual. So the individuals who will be in these tiny homes will be individuals who have tested positive but are not in need of that hospitalization, but still need a place to isolate and recover. And so that will be the real specified purpose of those units.
James from KORE, if nearby counties are urging the state to lift restrictions now, but we need to be aligned, should we expect to lift restrictions regionally or statewide?
So the question is from James at KORE Radio, and he was asking about the situation of restrictions being lifted county by county, and whether or not there's some thinking about regional restriction lifting. So I'm not aware of what that looks like in terms of a formal process of regionalization versus individual counties, but I do know that we've had active communication with our partners at other counties. And while some of them might be taking some proactive communication with the governor's office, what you see behind the scenes is a lot of coordination and a lot of communication about how this is going to work and how we're going to help each other during this process. You know, other counties have to do what's right for them, and then we have to make sure that we have the plans necessary to absorb whatever they decide, as well as do what's best for our county. So it's a tightrope, and there's no easy answer to that, but I can assure you that those conversations are happening.
At what phase in the reopening can bars and restaurants reopen, and what is the current plan for them to do so with social distancing?
So the question, I assume this comes also from James at KORE. It's at what phase would bars and restaurants open up, and where's the planning? What does the planning look like on that? So I do know that there are several different ideas being floated. We have not seen any firm direction on this. I have seen that pop up in a limited fashion in phase 2 and phase 3. But there's a lot of questions left to be answered. So can social distancing happen within a restaurant and have people be able to dine in but keep distance? Could you open up patios like we've seen some states do? So fortunately, we're in a position where, just like in our initial response, we can learn from other states, other counties, and even other nations, and see what has worked for them and what the case situation looks like. And that's what we're going to do. We're going to do what's best for Lane County to both prevent illness and hopefully move towards recovery of the economy. There is not clear direction on how that will look and how that will happen exactly, but we will be reporting that back out to the public as soon as we know.
We have a few questions for Dr. Leckie.
Alrighty.
From KLCC would like to know, is it believed that people who've recovered from COVID-19 can get it again, or are they immune?
So Rachel from KLCC asks about persons who have recovered from COVID, are they immune or can they get it again? You know, it's a question we all would love the answer for. If I were a betting person, I would say that they would have immunity for some time. We don't know how long. And if I could place it in sort of the level of knowledge that we have today, this virus is a beta coronavirus. There are 4 groups of coronaviruses. This virus is in the beta category. 2 other beta viruses came before, MERS, starting in 2012, and SARS in 2002, 2003. And both of those have immunity for a certain length of time. And you could probably extrapolate reasonably and say, well, if MERS gave immunity for up to 3 years, SARS gave immunity for 2 years, those were both much more severe infections, perhaps COVID-19 would give immunity for a year or so. The truth is we just don't know. For planning purposes, I personally am looking at immunity for perhaps a year, but it really depends upon how severe the infection was. Those people who had a very mild or asymptomatic infection may in fact create no immunity at all. They may have immunity for a few weeks at best. Those persons who were hospitalized had more severe infection, your immune system responds more robustly, and you tend to get higher levels of immunity. So, long answer to a short question. The truth is we just don't know, but we're hopeful that at least we'll get some months of immunity from an infection.
Alex at KVAL would like to know, are we able to start testing asymptomatic people yet? If so, is there criteria for that?
So a KVAL question from Alex about the ability to test asymptomatic persons. We're fortunate that we now have local testing, as I mentioned earlier. We don't have enough local testing. We still are focusing predominantly on testing those persons who are symptomatic and those persons who might be asymptomatic, but they're part of one of our contact investigations, and there's knowledge to be gained in testing them to see if they are in fact infected. We don't have enough capacity to test everybody who's asymptomatic yet. Hopefully we're on track to begin to be doing more of that work outside of the epidemiological uses in the weeks to come.
Will you please, for Alex, restate your goal for the number of people that will be tested weekly?
The goal for number of people to be tested weekly. So we're up at about 500, close to 500 now. We'd like to be at about 1,000 per week. That would be very helpful to us. And there are separate caveats of that. Jason showed the several-page draft of what we're working on. One of the caveats is, if all of that testing is out there but none of it is dedicated to public health, well, how do we respond to clusters and outbreaks? So we need some of that testing specific for public health purposes. So I won't go into all the caveats, but we'd love to see at least 1,000 tests a week done here locally. Very good. Thank you.